I know good things happen every day. And sometimes you hear about a little bit of the deficit, but good things happen every day. The County Board of Supervisors approved the first ever 10-year health strategy in their tenure on the board. And unanimously, and I don't have the time, but I'm proud to have this archived video, 4 minutes, where they're on video in that board meeting on July 17th of last year, boasting about how they're going to improve health in the region. So we've overcome that hurdle. So the issue here now is, how do we take the tenets of this 10-year plan, which is a service delivery reform, not a coverage reform? As Rob said, we're focusing with what we can change locally, not what can be done to us. And we're looking at, how do we improve the delivery of the 500,000 people we touch, and that with our partners? How do we improve the relationship of meaningful use of public health and human services? Because we know, right, access to care is important, but it's not the top 2, 3 in terms of driving health. It's dealing with poverty, it's education, it's literacy. And so how do we take the nexus of health and human services and improve the service delivery? How do we also make sure we don't lose sight and help families, adults, individuals take personal responsibility? We're not going to become the nanny state. No, I'm not going to take the toys out of the little McDonald's kits like up in Santa Clara. I'm not going to remove the salt from the table like maybe New York City did. We're not going to do that. We don't believe in that. But we do believe in educating everyone, so that when people come on to CalFresh, formerly known as food stamps, we can talk to them and say, do you need assistance on how to live in a budget to get healthy food? Or helping schools with school gardens and talking to children about the importance of their bodies and nutrition, and helping, in some cases, the kids help their parents, and doing it obviously in a culturally, socially acceptable manner. Health in all policies. Everything we do, we should be talking about health. And in fact, the Live Well San Diego is only one piece of its health. The other part is around safety, and the other part is thriving, which is about economic prosperity. And we talk now more about health, safety, and equity in all policies. Meaning, everything we do, how does it drive health, how does it improve safety, and how does it deal with equity? And every policy we do. I challenge you to do the same. I know many of you do. And then changing culture from within. Personal health reform starts with us first. How do we lead by example? How do we get ourselves in shape and take care of our teams if we're asking others of the community to do the same? So what does the future hold? You know, there's a great Irish philosopher that said, the biggest scale that you can get requires the simplest idea. And you can achieve this by connecting with people. That was Bono from U2. And basically, it's shared responsibility that needs each and every one of us to help build and sustain. It's connecting with people and thinking of the 3 for 50. What are those few things that can have huge impact? And so here's my one idea that I'm going to do real quick because I'm out of time. And the day in life of Ted, right? You could put ourselves in there, right? Ted doing diet, right? Work, quitting smoking, doing a lot of issues. Focus here a lot on the 3 for 50 I just mentioned. Well, we need a wellness approach. And I know we've seen these interesting pictures before. But I'd say we should capitalize on the accountable care organizations that look at the integration between inpatient and primary care and ambulatory care, and take that to not accountable care organization, but accountable care community. You see, we need an accountable care community that goes beyond just the hospitals and the clinics and the physicians, but all of us having a piece of that. And you may have seen this model before. It's the chronic disease model that Wagner has developed, but I built a little bit on it. We know this. We know this. How is it that we can't get these pieces together in broad scale? So ultimately, the timing of, closing thoughts, sorry, is simply this. We have a horrendous fiscal, we have lots of challenges, but this interoptimability, it's not good enough just connecting the dots, but how do we optimize those connections? And once we figured out that business model, how do we then overlay the technological tools? Really, that is the challenge for us. We are a nation clearly undergoing health reform, but San Diego, this is the time. And it starts with each and one of us, clearly. And I want to end on this point. Abrzent Igori. Call to action. It's discovery, right? Discovery consists in seeing what everyone else has seen and thinking what no one else has thought. So today's about discovery. This is the call to action. This is the future that we want to have in our community, where we have the sustainable, actionable communities driving health together. And I am proud to be here and a partner with you in achieving that. Thank you.